You are watching McLaren Port Huron Today's Health, and today I'm speaking with fellowship-trained Orthopedic Spine Surgeon Ryan Goodmanson about conditions that affect the neck or cervical spine. And in this segment, we're talking about cervical disc herniation. So Dr. Goodmanson, can you explain what that is?
Definitely. So in between the vertebral bodies of the cervical spine, there are discs, which are the shock absorbers of your cervical spine. Your cervical spine is very mobile, as we talked about before. And so these discs have a lot of stresses on them. And if you think of them kind of like jelly donuts, the jelly on the inside of the donut sometimes can squirt out. This can happen within the cervical discs as well. The inside can kind of protrude out, and that causes pressure on the nerves within the cervical spine and can cause pain, numbness and tingling, and overall discomfort for patients.
So how do you diagnose this condition?
Usually we start with a thorough history and physical exam, asking questions like if you had an injury, when did it happen, how long has it been going on, where your pain is. Usually if discs come out, they will push on nerves and you get pain in a very specific distribution within your arms or hands even. This is called radicular pain.
And are there some non-surgical treatment options that you would recommend for disc herniation?
Yeah, definitely. Once we confirm that there's a disc herniation by using MRIs to look at the nerves, we will do conservative things like physical therapy, muscle balancing, traction therapy to decrease the pressure on the discs, and even injections sometimes will help with the inflammation that's around the nerves.
And we know when those things don't work, then the next step is surgical options.
Step is surgery then,
so
yeah.
Can you talk a little bit about what the options are?
Sure. Kind of how we talked about before, fusion is an option for patients sometimes. But a lot of times when patients are younger, active, and have very isolated disease like a cervical disc herniation, there are a couple different options for them that are more minimally invasive and motion sparing. One of these options is to do a foraminotomy, which is to remove the disc from the backside of the cervical spine and decompress the nerves. This can do fairly well for patients, but is very selective on who we can do them on. Something else that we can do is called a cervical disc replacement. Now, this is an example of what a cervical disc replacement looks like. And a cervical disc replacement is essentially that. It replaces the disc that has gone bad, either because of herniation or degeneration. Typically, we would do these in younger patients who want to be more active, but it prevents breakdown of the levels surrounding the area. In contrast to a fusion where we lock everything into place and it's very rigid, this is a very mobile way to fix the cervical spine. It's done through a very similar, minimally invasive anterior approach or front approach to the cervical spine. And we go in, we remove the problem disc and replace it with the components of the disc replacement. This then, once put together, allows for motion at this segment. While it removes the problem, which is the disc, it decreases the problems that there can be with locking everything in place in young patients. This usually allows patients to get back to things like sporting, such as golf. It allows them to have obviously less pain because we get rid of the problem disc, and maintains their motion.
And I believe you have a model there that shows the fusion, so
Sure.
Just to show our audience like the difference between those.
Yeah, so the fusion, like we talked about before, locks everything in place with screws and cages. This is necessary in some patients. Where it is possible, we would like to do a disc replacement which preserves their motion, allows us to take care of the problem disc, remove the pressure off the nerves, but again, allows them to maintain their more anatomic type motion.
So you had mentioned that this is a surgery that you do from the front. Mm-hmm. So can you talk about that approach, like where's the scar and,
Sure.
and that sort of thing?
Yeah, very common question. Everyone kind of worries about that. Cosmetically, this is a very good procedure because we do it through a very small incision, usually about 3 centimeters on the front and kind of side of the neck. We try and find natural creases that patients have, and we hide the scar in natural creases. And because of the way the skin is in the front of the neck, it usually heals very well and becomes very difficult to even tell if you've had surgery. We travel down then through the front of the neck until we find the spine, and then we can do our work through a very small incision.
And is the recovery time from these two different procedures similar?
It's fairly similar. In my experience, I would say that people who have disc replacements recover maybe just a little bit faster because it's a smaller surgery usually to undergo. Now, it still is spine surgery, so it's still a surgery, but patients tend to do very well after these surgeries. Their motion is maintained, the pressure is off their nerves, and they're able to get up and move around and even go home sometimes the same day of their surgery.
And so the anticipated recovery would be similar as well?
It's similar, 3 days, 3 weeks, and 3 months. The rule of three is always. About 3 days for you to kind of get out of the fog of having surgery, 3 weeks until your soft tissue is healed. For these, typically, though, the 3-month mark is when patients are back to doing things like golf and more strenuous activities. Around 1 month is usually when patients feel like they are doing pretty well after surgery.
So you spoke a little bit like this type of surgery is recommended for some, where a fusion may be recommended for others. Can you kind of explain that a little more?
Yeah, definitely. So patients who have instability, a lot of instability, or severe myelopathy like we talked about before, which is the difficulty with fine motor skills, gait imbalance, and are a little bit more elderly, will typically do better with a fusion surgery as opposed to a disc replacement surgery. People who do better with disc replacement surgeries are those who have isolated 1 to 2 level problems, are younger and more active, and who need to preserve their motion for what they do in life.
And I think this is so important because it is the younger person. So again, telling people, don't wait.
Yeah, don't wait. If you're having problems, please come and see us. We will always start conservative. We will try and do this without surgery. But if you need surgery, if we get to the point where you need surgery, we are here to take care of you.
And I think that's amazing to hear that someone can be active so soon after surgery. Something
they can, yeah. The disc replacement is a great advancement in our technology, and it has really changed the way that we treat our patients, and being able to preserve their motion but still get them out of pain and get them back to the activities that they want to do with their life.
Great. Dr. Goodmanson, this has been really valuable information for our audience. Thank you for joining us today.
Of course. Thank you, Kelly.
And thank you. This completes this segment of McLaren Port Huron Today's Health. If you would like to make an appointment with Dr. Goodmanson, you can call his office at the number on your screen, or you can request an appointment through their website. You can watch more videos on our website at www.mclaren.org/PHTH. This is Kelly DiNardo for McLaren Port Huron Today's Health.